Hi, Dr. Carlson. Welcome. Thank you for being here in this series of QA questions.
Yeah, thank you for having me, Dr. Rajaei. Good to see you.
Of course, thank you. Thank you. So before we start, I know that I guess everyone knows you, but just in case, could you please introduce yourself and tell us a little bit about your background?
Well, sure. Well, I'm Tom Carlson, and uh, let's see, I'm a professor at Alliant International University in the San Diego campus. I'm also the branch director here. Um, I've recently moved here. Maybe people remember I was at North Dakota State University for a long, long time, 21 years at North Dakota State University. Uh, and so I've been at Alliant now for 2 years, which is a homecoming, returning home to California where I grew up, which is great. So
That's,
that's a great place. So to be so.
I have the bias, I should say that hopefully you're happier here with the weather.
Just just a little bit, yeah.
Okay, yes, my own bias, but I'm very lucky because I can call you my colleague here at Alliance, so I'm very privileged for that. So, to start, could you please tell us a little bit about narrative therapy? Everyone knows you with narrative therapy, but just a little bit about narrative therapy as an introduction. What do you think about it, or if, from your perspective, is it an approach? Is it a theory? Is it, what is
Yeah, well, how much time do we have? Just
it?
kidding. Uh, it's so that's uh the feared question of every narrative therapist is to give a brief response to what is narrative therapy. I could tell a quick story about that, but I was in South Africa before COVID, and I was doing a workshop there, and I got in the car in the morning, and they said, "Oh, we're gonna go to a radio station. People want to interview you about narrative therapy." And I'm like, "Oh no, they're gonna ask me to question," and I have 1 minute, you know, 1 minute to just say what is narrative therapy. So I really kind of racked my brain to think about what I might be able to say. And what came to my mind was that narrative therapy represents ways of being with and working with others that seeks to restore the beauty and dignity of their lives. Uh, so um, I was happy with that definition. It's a little different than maybe it's about externalizing problems or, whatever it might be. But I think that's the hope, the aim, the vision of narrative therapy is to restore the beauty and dignity of people's lives and maybe away from the ways that even psychology has had people think of themselves and their lives in pathological kinds of ways.
Mm, that's really beautiful.
Yeah.
It's another story, but you should tell me later how, if I were you, I would so anxious that I couldn't probably remember my own name. So the fact that you could come up with that definition or in 1 minute, that's really impressive. Thank you. And another question, like following on up on that, and I know that we're going to talk about narrative therapy in much more details, but just again, like to start, we work with a lot of students and mentees, right? And as you know, a lot of times students, especially like in the beginning of their journey, they always ask this question: how do I know like which theory, which approach I should use? How do I know that this is a good fit for me? How did you realize that narrative therapy is a good fit for you on your own journey?
Yeah, that's a good question. I studied family therapy a few years ago.
Mm,
and narrative therapy was still really new, wasn't really being taught
mm,
in even courses really yet. It was at the very end of my master's program, but so it was new, and it was an exciting time in family therapy because the feminist movement was really strong.
mm,
The kind of social justice diversity movement is starting, and narrative therapy, postmodern therapies was starting. So it's kind of an exciting time. And uh, I remember learning structural family therapy, which I tried out for a while, and it wasn't quite a fit. And then I remember as a student feeling a little bit despairing
mm,
uh, because I had some hopes for what therapy might be. And it wasn't about helping people cope with symptoms the rest of their lives.
Mm.
And it wasn't about helping people manage better or to regulate their emotions better. That's more of a contemporary thing, but it wasn't about that. I had hopes that maybe therapy could be about a transformation of a life.
Mm.
And I remember being told a little bit that that's too big of a hope. And so that was part of the despair, is that a lot of the approaches I was learning weren't about that.
Mm.
Uh, and then I found narrative therapy. And narrative therapy is a therapy that does have ambitions or hopes for the transformation of a life. You know, you change a story, you change a life. And I remember reading a particular quote from Michael White. This is just off the top of my head. It might not be exactly right, but Michael White was asked to talk about, this is in the book Reauthoring Lives,
Mm.
and he was asked, how would you describe this approach? And Michael's response was, well, first of all, I wouldn't call it an approach. Perhaps a philosophy, an
Mm.
epistemology, an ethics, a commitment, a life.
Mm.
And I think I found, at least in narrative therapy, for me, that really resonated for me. It wasn't a way to do therapy with people 9 to 5 and go home and just live my life, but it was a way of living my life.
Mm. Mm. That's really, every time that you quote something or you talk about narrative therapy, I wish it was like movies. There was a like background music. So because it's just one of those moments that you want to pause and digest. So I really appreciate it. And it makes a lot of sense. So obviously you teach narrative therapy, and not only in theories class. I know sometimes there's also a course called narrative therapy, and I've heard so many good things about your classes. No doubt about that. What are some of the activities that you practice in the class with the students? I think that narrative therapy is kind of like not but like a way of living. Like it's how I think about it when I think about like being a therapist, being authentic, like not just doing therapy, being in therapy. But what do you think, or what do you do in class with the students? Some kind of practices or activities that maybe like they are highlighted in your teaching approach, or in just the way that you practice it?
Yeah, it's true, where you say that narrative therapy isn't like a series of steps,
Mm-hmm.
right? Or that you can do, but it's uh, a way of being with people. Uh, David Epstein talks about how it's about the kind of redignification, people's lives, but meaning that it really is an ethics about how you treat people
Mm-hmm.
and how you see people. And so part of it is, how do you help people experience that? How do you help students experience the ethics, the vision of who people are, and to see people in ways that are honoring and dignifying of their lives? And so outside of just teaching the theory, which is really important, I'm one of those people who believes really strongly that students, faculty need to teach theory really well. And what I mean by theory isn't techniques, because that's not the theory, but it's the ideas, the philosophies behind it. Because once you step away from the theory and philosophies and the politics of the ideas that inform the interventions, you can use the interventions in ways that are harmful to people or that go against the philosophical and political aims of the theory. I know that, just a side note, narrative therapy has often been referred to as a political therapy because it addresses on purpose the social discourses that shape people's lives, and challenges and critiques those discourses, the labels people come to therapy with. But every theory is a political theory. Every theory has political aims, whether they say it or not.
Mm-hmm.
A theory is either pro-cultural or countercultural. Uh, and so that's why teaching theory is really important. So that said, I do a lot of that in terms of teaching the theory and the political ideas that inform the therapy. But in class, what I really want to do is give people students an experience of what narrative therapy might be. So like this summer in my class, what I did, one of the things that's unique about narrative therapy is narrative therapists write documents, therapeutic documents. And one of the more recent ways of doing that is by taking clients' words in an interview and transforming it into a poem that is like a spoken word poem that's read back to them in the next session. That practice was developed by my colleague, Sunny Paliaka. And the idea is that you take their words and you turn it into a story where they are the protagonist, the center of the story, making decisions on purpose in response to struggles in their life. And one of the things I did this year is I interviewed students every week, one student every week, about why they wanted to become a therapist, their hopes, their dreams for becoming a therapist, and interviewed them in a way that to find stories of their lives that would help them understand why it is that this particular commitment, that their hope for clients and whatever that might be, and the students during those interviews were taking notes really closely as if they were the therapist in the room. And then each of them took those notes, turned it into a poem, and then next week read the poem to the student who was the recipient of the interview, who was the interviewer anyway. And that student then got, 20 poems, witnessing poems in response. And so that's a way of both giving the students an experience of what it's like to be interviewed and to witness an interview, but what it's like to be responsible for, or what I might say, a faithful witness to a person and in their life. And I think it went really well. I think the
Bet,
students
yeah.
said so as well. And the effect of the person who then received all those poems and was read those poems, was like, some people's like, I'm convinced about this narrative therapy thing.
Yeah.
Yeah.
It seems very deep and also reflective, which is awesome. I really appreciate that, and thanks for sharing that with us. Yeah, that makes me think about this kind of like debate that is sometimes in our field about being a therapist. And some people, they believe that you can be an amazing therapist. You go to your session, you do your job, and then outside of therapy, you just live your life. And like, I know that it's exaggeration, but just for like lack of word, like you can be a horrible person, right? And then some people believe that like therapy is not something that you can fake it or you can do it. It's about being. So it's about lifelong journey of just like, besides all these different techniques and theories, philosophy that you use, who you are. We have all these different tools in therapy, including the techniques or approach that we use, but maybe the most important tool is ourselves, right?
Yeah.
So and so the activity that you mentioned, I really appreciated. And you were talking about other also approaches before, and sometimes in different like situations, exams, or like conversations with the students, there's, I think from my perspective, there's this myth that the students think that if they want to be loyal to an approach, then it means that they are purely doing whatever like was developed, I don't know, 30, 40, 80 years ago, and they do that. And I always have this conversation with them that our diversity and inclusion training, it's a lifelong journey, and what we have today is different from 30 years ago, so we can always modify all these different things. And so now we are talking about one of my favorite topics, diversity, social justice, and inclusion. And when you think about narrative therapy, what do you think about the role of diversity, inclusion, and social justice issues, or in social injustice issues in narrative
Yeah.
therapy? And I know
Yeah.
that you just wrote a chapter and you have a very exciting concept in that. So if you want to talk about that as well, I would appreciate it.
Yeah, well, one of the things that really drew me to narrative therapy already is that at its center, at its core, is an awareness of the ways in which um, cultural discourses uh, um, and normative standards around what it means to be a, you know, a good person, a proper person, which is usually influenced by gender, ideas around gender, race, sexual orientation, all of those ideas, how those ideas shape a person and shape the stories that they live by. And so social justice and a commitment to making therapy a political act in a way. Michael White talks about repoliticizing that which has been depoliticized. And that narrative therapy is about people experience suffering in life in the realms of human relationships, but also in the realms of systemic inequalities, for example, right? Racism, sexism. And the suffering happens there in that context, right? By how people are treated and mistreated in the world. And then therapy, psychology, even family therapy removes people from the side of their suffering and tries to treat it in a psychological realm. You know, like, so I'm going to treat someone who comes to therapy. This is a very recent phenomenon, but people come to therapy and they say, I have trauma. Well, I don't know if people have trauma. Like, is that something you can have? Or is trauma an effect of how a person was treated or mistreated in their relationships with other people, with other social systems, institutions, ideologies, you know, et cetera. And so narrative therapy at its core is committed to returning people's suffering to the context of its creation. Meaning,
can I pause you for a second? Sorry. For those who may watch us and they may not be familiar a lot with narrative therapy, could you please tell us what's the difference between having trauma versus trauma is an impact of, you know, the discriminations or experiences or social injustice issues that someone experienced before?
yeah, I mean, to say I have trauma and then someone will come to therapy, a therapist, and a therapist will just treat the trauma. Meaning, I'll give you now strategies and steps to help you kind of deal with trauma as if trauma is a universal kind of thing that people experience. And no one person has the same kind of experience of trauma. This is one of the critiques of not of narrative therapy, but by narrative therapy, is that we can't treat people as if they're universal. You know, a problem is not a universal problem. Treatment, you know, standardized treatment manuals. There is no one experience of trauma, right? But there's a particular person who's had a very particular experience in the world of how they were treated by another person. And the aim of narrative therapy is to return this experience that's been labeled and given a general label into a just and fair context of their lived experience. And just as an example of that, as maybe a pet peeve of mine anyway, is the diagnosis of like borderline personality disorder. And you know, borderline personality disorder, as we know, is almost entirely exclusively a gendered diagnosis. It's given to women at I don't know the exact percentage, 85, 90%, right? Anytime you have a diagnosis that is that gendered, it should raise some questions. That means there's some things maybe going on in our culture and biases going on, right? And so people are come to therapy with a diagnosis of borderline personality disorder. And these are usually women who have difficulty with managing their emotions. They're often called women who are maybe get too angry, explosive in that kind of context, right? And well, we might want to question who has a problem with women's anger in the world. And sorry. Sorry. My computer just moved away from the screen. You're still there. I was worried. Anyway, yeah, who has a problem with women's anger in the world? world. And I have some questions about approaches to therapy that discipline, the disciplining of a woman's anger, for example. And narrative therapy would seek to maybe understand a woman's anger and put a woman's anger back into context of living in a patriarchal society. Anger as a response to mistreatment and injustice, but not to try to help someone manage the anger in a way that quiets it or disciplines it in a way. I don't know if that's a good example, but
it is an awesome. I think it's a very clear example. So I appreciate that. I think it's, I know funny is not a good word, but it's sad, actually. The way that sometimes like these things are happening here, and then especially like all of us, but especially women, like we do this and it comes back to us. Like I am the problem,
yeah,
right?
right.
Versus like addressing the things that are going on here. But we do a great job in our society that like this dynamic happens, right? Instead of addressing all these different things, it comes back to ourselves that I am the problem. Like it's about gender, it's about economic status, right? Like that, oh, I'm not working enough or I'm not enough, versus like this capitalism society that, whatever you do at the end of the day, it's not enough. And
Right.
1% of people, they get richer, and the rest of us,
Yeah.
we are running and running. But yeah, so do you want to also talk about that? I know that you kind of like explain about it, but do you also want to talk about that concept that you wrote in the chapter?
Well, yeah, it's related. So it's kind
Yes.
of an
Yeah.
extension is, so I've recently, just in the last many, I don't know, 5, 6, 7 years, just in teaching and doing supervision, reading articles written about narrative therapy. This hasn't only happened to narrative therapy, it's happened to all of our approaches to therapy. In the world of manualized treatment and every evidence-based treatment, people are taught just to treat problems as if they're universal, and that it's a problem like anger or depression, and we just treat it as if it's a general problem experienced by a general group of people. There was a student who finished her studies and then went to a job interview, and at the job interview, they asked her to do a role play, and they said, okay, the problem is anxiety. Go. And she's like, can you tell me about like this? Is there anything I should know about this person? The person. And they're like, no, that doesn't matter. Just what are the steps to treating anxiety? Go. And she was really confused, had a very difficult time. But I think that's kind of symbolic of kind of where we are and how we've come. We learn techniques to do therapy outside of the theory, outside of its political context, right? Yeah. So this has happened in narrative therapy too, where people are taught the technique of externalizing, and they're taught, well, I'd say wrongly, probably, but they're taught that externalizing is the idea that you name a problem and you help a person separate their identity from the problem. And that's what most people think externalizing is. That's not what it's about, actually. Externalizing conversation is not about separating a person from a problem. It's helping a person separate or question or critique the dominant cultural ideologies and the normative standards that have led to a person's experience of the problem. So you see the political tie, right? It's political in the tie, right? So when you're working with a client who comes to therapy, like a woman comes to therapy with an anger problem, and the narrative therapist then just says, oh, anger. Okay, anger's the problem, just accepts it without trying to understand the context in which it was created and where it comes from. And does it have something to do with gender and patriarchy? Whose problem is it anyway? And they just jump right in and help the person separate from the problem. Okay, so what does anger want from your life? What is it trying to steal from your life? What are some ways that you can, strategies that you can take your life back from anger?
Mm-hmm.
That can do a lot of harm and actually can reinforce the cultural and political idea or aims of patriarchy if you're not careful. And so what I always say is, well, when someone comes to therapy and they present something like anger as a problem, we have to first understand if it's a problem or not.
Mm-hmm.
And whose problem is it?
Mm-hmm.
And so I might still use externalizing conversations, but not for the purpose of separating the person from the anger, but understanding it and understanding where it comes from. So I might say, well, where in your life or when in your life does such a thing like anger show up?
Mm-hmm.
And I might find out that anger might show up in a workplace. And then I might be very interested. This is a woman, this is an example, a real example. This is a woman in a workplace who's not only experiencing anger, but also panic in the workplace. And I might then be very interested in, well, tell me a little bit about your workplace when panic shows up. You find out that this woman is the only woman in a large engineering company, for example, right? And so does that matter in terms of when something like anger might show up or panic might show up? It does matter in that sense. And if anger or panic comes as a response to mistreatment by the men colleagues at her work, the liberties and licenses that they take to talk about her body, to touch her body, meaning that anger or panic might show up as a living response to rape culture. What happens if I separate her from her anger when it's a living response? What if anger is a counsel, a wisdom, an alert system that she needs to come closer to, not further away from? And I can use externalizing conversations the very same way, in a political way, by asking something like, if anger were a wisdom, what would it want? What would it be trying to tell you in this moment about what you're not okay with? What kind of counsel would anger have for you in terms of what you might do in response or whatever that might be? But do you see the purpose of externalizing conversations in that moment might be to help her become closer to anger, not to separate from it. And if we just jump in and take away anger, what we might be doing is reinforcing patriarchal norms, encouraging her to be more quiet, to be more disciplined, right? At work, right?
Exactly.
So,
Yeah. Kind of like you're talking about with the conversation that we should have with her, where you're talking about maybe changing the relationship that she has with the anger, right? So like being more in tune with what does it, tell her in those moments, and kind of like the insight into the context and kind of like awareness of the societal and patriarchal kind of like things that are going on, at least like in her work environment, not that it's going on anywhere else. But yeah, so talking about that, which again, it can be really helpful. I think one experience that I have in working with clients myself and also working with supervisors and students is that, like, in all of this, since experiencing, for example, anger or sadness or grief, all those different things, it's usually not a pleasant experience. It's unpleasant. Because it's unpleasant, because it's painful, therefore, and again, like talking about context, I think we are living in a society that we are looking for, just removing the symptoms, right? So just because it's unpleasant and it's painful, the first thing that we want to do is just removing the symptom, right? Go to a comfortable, like pleasant experience or situation meaning I'm going to help you as a therapist to do some meditation or,
Yeah.
whatever, to deal with the anger or whatever you are experiencing. And I think that's tricky for both clients or human beings, and also for therapists or trainees or, students who are working with clients, because that's also uncomfortable for them. And
Yeah.
I think that plays a dynamic in what we see in
Yeah.
therapy rooms, if that makes sense.
Well, yeah, absolutely. Clients often come into therapy, at least in my experience, feeling like they're failing to do something properly,
Hmm.
not like grief, for example. I'm failing to grieve properly. Um, and or they're failing to be emotionally regulated properly, or whatever that might be. And what I the way I think about that is that we live at a time, and this is in a the ideology is called neoliberalism, and I don't need to go into
Hmm.
into what that is, but it's in a time where um, people are told by psychology, popular psychology, that they should live their life a very particular way. There's things that they should do. There's a timeline in which they should do it, and a timeline in which they should suffer and then return to work and be
Mm.
productive, right? And so people are always trying to police themselves in terms of, am I doing it the right kind of way? And so someone might come because of prolonged grief, for example,
Mhm.
right? I think that's even a new disorder in the DSM, but uh, right. And the pain they're experiencing isn't just that I've lost someone that I love, but the pain is I'm not doing this right. There's something wrong with me for grieving
Mm.
so much because I'm not doing it right.
Mm.
And uh, and so for me as a narrative therapist, I'm really interested in challenging any idea of that there's a right way to do something. Uh, and I had a woman come to therapy who was in that kind of situation 2 years after the death of her husband. Uh, Two people who met each other after being diagnosed with MS,
Mhm.
and they're in wheelchairs, and they found love. It's a really beautiful story, but
Mhm.
her husband died,
Mhm.
uh, and she is just low, and for 2 years is low, and people keep telling her, you have to move on, you have to move on, and she feels terrible because she's not doing it correctly. Not only add insult to injury, she's not doing it correctly, right?
Mhm.
And so my interview with her was about, well, what if grief wasn't a problem, but what if the extent of your grief is in direct relation to the extent of your love?
Exactly.
uh, and of course she cries in
Mm.
response, and then the interviews was about ways of her honoring the love
Mm.
that she shared between him, and her feelings of pain are a way of honoring that doesn't have to be a problem. In it, I mean, it transformed. Even when she feels the pain, now she can feel the love, right? And
Yeah.
in that way. But a lot of the problems that people come to therapy with, in my opinion, are um, problems that people have been told they have by psychology, popular psychology, positive psychology, whatever that might be. And so I've created a new slogan for narrative therapy. The slogan is, the person, not the problem is the problem, right?
Yes.
So my new slogan is, the person's not the problem's not the problem. The very idea that you think you have a problem just might be the problem.
Hmm. I like that. Yeah. Yeah. Which that also comes from the messages that we get from
Yeah,
society and societal norms and culture. Yeah.
exactly. Yeah,
That's really interesting.
yeah.
Yeah. So as I studied medical family therapy, so you sometimes work with a lot of clients with different medical issues, and it's interesting that usually we have this conversation that they talk about how they kind of like overcome their like the issues, the physical issues that they have, if like they had different surgeries or there's this scar on their skin, right? All these different things. They became okay with it,
Mhm,
and why they are not okay with their emotional like traumas or scars or issues in their own language, right?
mhm,
And they think that's a problem with them, why they are not like strong enough, why still like going to XYZ situation or like places, or whatever triggers them, or they go back to exactly what they experienced, I don't know, when they were 10 years old. And we have this conversation about something similar to what you mentioned, that how your idea, first of all, about like problem, like we challenge that, and also at the same time how sometimes like emotional experiences or issues or whatever we want to call it could be harder. They have like more roots, and since sometimes they're like invisible, it's even like more difficult to like deal with them, or process them or heal them, versus like a physical scar that is like on your hand, or whatever. So if that doesn't make sense.
Yeah.
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 So based on what you were talking about, I have this question, and I'm wondering if others also thinking about it. Does narrative therapy agree with the concept of functional, unfunctional? Not based on, a set of like criteria that we have somewhere, but like based on the client's story, like functional or unfunctional. We were talking about grief or, anger, functional, dysfunctional. And also, does narrative therapy agree with, for therapists, the fact that who you are as a person is important in what you do as a therapist? So I guess there are two questions.
Yeah. Well, I'll take the first question first
Mhm.
about like how narrative therapists think about ideas of functional or dysfunctional. Uh, um, yeah, I don't know if those are terms that
Mhm.
are uh, are maybe thought about a lot or
Mhm.
maybe helpful for a
Mhm.
narrative therapist. I think um, I think more in terms of, and narrative therapists probably think more in terms of um, uh, people. People are narrative therapists because, based on literary theory, see clients as protagonists,
Mhm.
right? They're protagonists in their life. A protagonist is someone who is actively shaping the events of their lives according to their moral purposes, their values, their commitments in life. But they're the shaper of the events of their life. And most people come to therapy not viewing themselves as protagonists, but they're viewing the events of their lives as, these things happened to me.
Mhm.
These things were done to me,
Mhm.
right? In that sense. Um, and so they come to a story, they're experiencing their life, the things that happen, as from the place of kind of a passive recipient of the happenings of their lives. And that's one version of the story. People from a narrative therapy perspective are always responding. They're always responding to the things that that happen to them, um, meaning they're always acting and responding according to their purposes. They just don't know that often when they come to therapy. And the job of a narrative therapist is to help uh, find within the stories of the things that have happened to them, that have been done to them, the ways that they responded as protagonists,
Mhm.
and to develop a story that shows how they have been responding uh, in their lives in a way that is in contrast to, as a counter to the things that were done to them, meaning living their lives on purpose, um, according to their values, their purposes. And so narrative therapists probably think more in terms of agency than functional or
Mhm.
dysfunction.
Mhm.
But how do you help a client return to the place of a moral agent or a protagonist in their life?
Mhm. That's really beautiful. And I assume like talking about it is easier than, practicing it, or, having it in your life. But I do appreciate that you explained that. What about the next question that I had, like about who you
Yeah.
are as a therapist?
Yeah, I mean, who we are, of course, matters. And the way that I think about it, and I think most people who were drawn to narrative therapy in the early days, when it was people were watching Michael White work or David Epstein work, and I've heard people tell these stories, is sure, the ideas externalizing this is interesting, but that's not what drew them to narrative therapy. It was the ways that they saw Michael and David treating the people that they were working with, treating them, the way they showed their respect and their regard for the people that they were working with, the way they centered people's lived experience and not their own lived experience. And what I would say is, yes, the person of the therapist matters, of course. But what I would say as a narrative therapist, what I'm most interested in is in my own work and in teaching students is to live really closely to their own ethics. And what I mean by ethics is, how do you most want your clients to feel and experience themselves in the room when they're with you? What do you want them to most know about who they are in this world? And how can you go about centering your work around those ethics? And in narrative therapy, a person isn't people don't have inherent kind of traits or personalities. There isn't even an authentic kind of self. But there is an ethical self, a self that is always striving to consider very carefully the effects of their actions on the lives of other people. And Michael said that as therapists, all of our actions and interactions are shaping clients' stories of who they are as people. And we are in a great position of a responsibility or accountability for the ways that our interactions shape the stories of our clients' lives. And so it's important that we take that very seriously as narrative therapists. And I would say that that's an ethic for life, that each of our interactions, words, thoughts, inactions, whatever that might be, are always shaping not just our clients' lives, but our partners' lives, stories of their lives, our children's lives, our colleagues' lives. And we can't escape that kind of responsibility for the ways that our actions shape another person's story of self. So
that is very true. Thank you. And so how can we work on that? If I was a master's student and I would come to you and say, hey, Dr. Carlson, I read all the books about narrative therapy. I took some classes. How can I work on myself or on this ethical concept that you're talking about? What would you say?
yeah, well, I wrote a paper about this, but it's a long time ago. I actually wrote it when I was a master's student, so it's a really long time.
Wow, that's impressive.
Meaning it's like 1997 that it was published or something, but so a couple years ago. But what I do with students is I ask them when they first start doing narrative therapy, hey, forget about doing it right. Forget about all the steps. And I want to ask you one question. And I want to ask you, what is your greatest hope for how your thoughts, your actions in the room with this person that you're going to see, the next hour, what are your greatest hopes for how your thoughts, your actions shape who they are as people? Another way to say that is when they leave that room, what is your hope for how they feel about how you feel about them as a person? So that's a little convoluted, but it's on purpose. Meaning not how my hope for how they feel about themselves. That's not the point. It's about how they feel about how I felt about them, the kind of person that I saw them as. And
Dyadic,
meaning it's I'm the one responsible for how they feel about themselves. Right. and to go into that room and to make sure that that is the center, whatever word that I come up with, that I want them to feel valued, loved, whatever that might be, that that become the center ethic
Mm,
of my work,
mm,
that I carry that with me on purpose
mhm,
into the room. Uh, and that's what I would say as a starting point uh, to any student,
mm,
is to center in that place and let the theory follow, let the practice follow. But
mm. That's very helpful and practical. Thank you. Thank you for sharing that. You know, that's the thing about narrative therapy. Whenever we talk about it, it's just like it's like a poem. Like it's just
it's
so
like, mhm.
beautiful. So thank you for answering all of my question. That brings me to my last question that I ask all of my guests here. What is one thing that you would tell the younger version of yourself when you were maybe an MFT student about becoming a therapist?
Well, that is a good question.
Mhm,
Uh, I wrote a paper about this a little bit. It's called uh, There's Always a Puppy." Is what the paper is called, and it's kind of about my experience of becoming a narrative therapist. Um, and I think what I would say is, don't let yourself. We all come into this field usually before we're trained about what it means to be a therapist, before we're disciplined into the role of being a therapist, that we all come with hopes and dreams. We all come with talents and abilities about how to treat people, how to relate to people that we've known for a long time, that we've nurtured, that we've developed because of the life that we have lived, because of the suffering that we have experienced. And our sufferings, our struggle in lives are not pathologies or barriers to be careful about in that way. Like a lot of self as a therapist training has us look back on our lives as in a way that's a pathological kind of way. We look at, uh-oh, because I had this struggle in life, I have to watch out for it, you know. Uh, but what I would say is that a lot of the things that we have struggled with in life um, might make us uniquely qualified to work with and care for people who've struggled, and that uh, to remember that, and to not let go of our own histories, our talents, our abilities that we have nurtured throughout our lives. Michael calls them hard-won knowledges,
mm,
um, and to not lose sight of of our humanity, our hopes and our dreams, once we then are trained to be a therapist. Uh,
mm,
I had a colleague of mine, a student, who said, I interviewed him about his experience of being trained as a therapist. And he said, it took me 5 years after my experience of going through a PhD program and everything to relearn how to connect with people.
mm,
Because before I was a therapist, I knew how to join with people in their suffering. But then I learned joining as a professional skill.
mm,
And I was encouraged to step away from what I knew in my life. And I had to relearn that. And I guess my encouragement to myself and to anyone else is to to not let go uh, of the things that you know, the hard-won knowledges, the talents and the abilities that you uh, are uniquely yours because of the life that
mm.
you have lived, uh, and to draw on those. Um,
Yeah. Yeah, very true. Sometimes I feel like for some of us, at least some days or, parts of our lives, I think if, you would ask about a name of a chapter for that, day or part,
yeah,
I
yeah,
think for some of us that would be, or at least I call it, City of Stars. I think it's just,
Uh-huh.
it's like that the sky is dark, but
Uh-huh.
that's the reason you see all those stars are like shining, right? Sometimes I think about our suffering and pain like that, that it is hard, it is difficult, it is dark. And at the same time, the reason that we are who we are today, and whatever adjective you're going to use, kind, to whatever, it's because of that context that we went through. It doesn't make it okay, because I know sometimes the things
Yeah.
that happen to us, they're like unfair, blah blah blah. And at the same time, that's part of life.
Yeah, those sufferings we have experienced, yeah, definitely not okay, but we responded to them on purpose, and we
Hmm.
took up an ethic, a passion, in some reason that I will not suffer.
Yeah.
I will, meaning I will not let another person, suffer, in this way, and for people to understand the history of that desire and how it's tied to the history of their life and their experience, that matters a lot,
Hmm.
and it'll make it much more possible for them uh, to draw upon that in their work with clients, rather than a professional knowledge that's up here that they have to try to access. It's a merging of professional and personal knowledge, right? That a person has access to. So
I love that, merging professional and personal knowledge.
yeah,
That makes a lot of sense.
yeah.
Thank you, Dr. Carlson. I asked all of my question. Is there anything else that you want to say, or anything that you want to add?
Um, well, I mean, I think I've made made some of the points that I want to make. I do want to say one thing,
Mm-hmm.
and this is a comment that David Epstein shared with me not very long ago, just maybe a month ago,
Hmm,
uh,
very
and
recent.
very recent. Yeah, and he's talking about narrative therapy when it was first introduced. He's reminiscing a little bit about that, uh, and he said that, when narrative therapy came out, it was considered pretty radical, at the time. And you would think that however many years later, 35 years later,
Hmm.
something like that, that maybe narrative therapy wouldn't be as radical. But he said that narrative therapy, feminist therapy are more radical than ever. And what he means by that is that the therapy field has become more and more conservative over time. Even with the rise of awareness of diversity and social justice, the therapy profession has become more and more conservative, meaning where therapy has become more and more manualized, right? Uh, and when you become universal treatments to universal people, what happens to the people whose lives are at the margins?
Hmm.
Uh, what's happened in family therapy, for example, to um, all of the writings and theorizing around feminism, around social justice, around anti-racism.
Hmm.
You look at the field and look at the writings. Um, uh, we've become more and more silent as a field around those issues, and that matters to me. We need I think we need yeah, a uh, another imagination, revisioning, reinvigoration of our field around ideas of justice, uh, and figure out a way that we can, yeah, make therapy a bit more radical again. So,
Hmm. Yeah, I couldn't agree more. Yeah, may it be
so
more radical. Yeah,
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 exactly.
yeah,
Thank you. Go
yeah.
ahead, you
Well,
were going to say something?
no, I was just gonna say
I,
I agree. Yes.
yeah, exactly. Yeah, I mean, we don't have time. I can talk about this for hours, but since we
I
don't
know.
have time, I just say I couldn't agree more. Yes. And thank you for finishing, kind of like ending our talk with such profound and deep quote from your friend and colleague. I really appreciate this time. I know that how busy you are. Thank you so much for making this 1 hour to talk with me, and I'm sure that students, colleagues, therapists who watch this video later, they will enjoy learning from you. So thank you for that.
Yeah, it's my pleasure. Thank you so much. Thanks for all you do. this is really important forum for students and for
Yes,
anyone wanting to know more about family therapy. So thank you.
of course. Thank you and have a great day. Bye.
Yeah, you too. Bye.